All right, we will go ahead and get started. Thanks for joining us for our COVID-19 media briefing today. We have Kevin Dick, District Health Officer for Washoe County. Kevin, if you're ready, please go ahead.
All right. Can you hear me, Scott?
Yep, you're good to go.
Okay, good. Thanks. I was having trouble getting unmuted. So thank you, Scott. Thanks, everybody, for joining us today. I wanted to give you an update on where we're at with COVID-19 in Washoe County. And unfortunately, it's not good news today. We are at the highest number of daily cases that we've had to date. So we're continuing to surge. Our 7-day moving average for new cases per day is at 127. That puts us at 29.5 new cases per 100,000 population. And so that puts us in the red zone. We're designated as a red high-risk county under the Harvard Global Health Institute criteria and Brown University now for how they're tracking counties across the country. We remain at high risk with our COVID risk meter here locally, and the White House task force has raised the risk in Washoe County to red, high risk, based on the high level of transmission that's occurring in Washoe County. We remain flagged for elevated disease transmission and with increasing numbers of cases being identified, as well as high positivity test rate. We're at now 8.6% for the positivity rate. That's in spite of us having still a lot of testing going on. So we've reached the highest number of active cases in our community. We're now over 1,500 active cases that are occurring. And so the direction is the wrong direction with this continued increase. And I appreciate the governor's comments yesterday in which he reminded people that we need to continue to be vigilant. So we may be tired of COVID, but COVID is not tired of us. And so as we want to get back to normal and we start relaxing, we see what happens with that, with the number of cases that are occurring. So we need to remind everyone it's still, it's more risky to be out and about in our community than it has been to date. And people need to be taking precautions, avoiding gatherings, wearing masks, and social distancing. In conjunction with that, I wanted to make a comment regarding Halloween and Dia de los Muertos and the traditional celebrations coming up for those and for Nevada Day over next weekend, the weekend a week from now. The CDC has put out recommendations, and we're in agreement with those, that many of the traditional Halloween activities are high risk, and we're recommending that people not be trick-or-treating because of the risk associated with those. The CDC guidance outlines other lower risk activities that people can use to celebrate. We'll be putting out a press release later today with our recommendations. They'll be consistent with those things like carving pumpkins, decorating, watching Halloween movies. If you're going to have Halloween costumes, can still be good, but to celebrate and enjoy those with your immediate household versus being out trick-or-treating. So with that, that's my update on where we're at, and I'd be happy to take any questions.
All right, go ahead and fire away with questions, or leave them in the comment box and I can read them if you want.
Hi, Shaditi from This is Reno. One of the questions that I have for Kevin Dick is what is the reason that do you think that people are not being able to maintain simple measures like mask wearing, maintaining social distance, and sanitization? Like, what are the challenges that is stopping people from doing that?
I think people are just relaxing behaviors, and they're thinking that if they are, with friends, that it's okay to go ahead and take off the masks and hang out together, those types of things. But unfortunately, what we see are that those are activities that are leading to spread of disease. We're still seeing cases that are coming out of gatherings and parties and celebrations. We're seeing cases coming out of workplace settings. We're seeing cases coming out of the different activities that people are, whether you're going out to grocery stores, when people are just out and about, or with the schools open. We do have cases that are occurring in our school children and staff at the schools, as well as continuing cases at UNR.
Do you think that people's confusion around mask wearing or herd immunity might have a role to play?
I think it's unfortunate that there's a lot of mixed messaging and misinformation that's being provided to the public. And I would encourage the public to really follow what you're hearing from your public health authorities, both at the national level, the state level, and locally.
Thank you.
Hi, this is Tabitha Mueller from the Nevada Independent, and we're curious to know whether any of these cases could be potentially linked to some of the recent rallies that have been happening, specifically to President Trump's rally recently.
I don't have any information of a case tied directly to the rally. I think it's probably a little bit soon for us to be seeing anything specifically coming out of the Trump rally that occurred down in Fallon.
Hey, Kevin, Scott Sonner at AP. Do you think it's time to start considering reinstating some of the limits that we had earlier? And especially, do you think we've really thought through the idea of allowing such large crowds at casinos?
Thank you for that question, Scott. The Here in Washoe County, we've decided that we're not going to approve larger gatherings of more than what's allowed under the governor's directive for gatherings of up to 250. And with the exception that we said we would consider outdoor venues with fixed seating. As you're probably aware, we did approve the Greater Nevada field to reopen, but we felt that they had a very safe approach and they were able to spread out people and manage that appropriately. It does concern me that we have gatherings of up to 250 people occurring and without any approval required. Once though that directive is made, it's difficult to put the horse back in the barn. The governor has allowed for local governments to establish more restrictive measures than that 250, but there hasn't been an appetite from the cities and the county to move forward with something like that. That said, with the level of disease transmission that we have, it's not advisable to be having gatherings that size. And with the White House recommendations that they came out with originally, as they identified the red and the orange risk levels, They suggested that gatherings be limited to less than 25 in the orange risk level and 10 or less in the red risk level that we're in now. I guess I should take this opportunity to also to remind everybody that while the governor's directive does allow for up to 250 people to gather in the controlled and regulated environments that would occur in a casino or a convention center, et cetera, things like that, that the governor's directive also does limit indoor private gatherings to 10 people or less and outdoor gatherings to 25 people or less. So just to remind people with the Nevada Day weekend and Halloween, et cetera, coming up, that it's a violation of the governor's directive to have a gathering more than 10 people indoors or 25 people outdoors, private gathering.
Hi, Kevin. It's Ann Jeanette from the Reno Gazette-Journal. Why do you think that our elected leaders have no appetite for following the recommendations of the health professionals at every level, from county to the White House?
Well, that would be speculation on my part. I think it might be better to connect with them directly for that. But as some background, you know, there's the public health perspective on this. There's also obviously other pressures in regards to the economy and people's desires to be open. But that's speculation, and I think you should ask them directly.
They haven't told you directly while you're having these conversations? I mean, I imagine that they turn to you for some advice on this. They're not voicing how they're balancing those things?
No, they haven't provided me with that. My communication's been occurring through the city and county managers for the most part, and with their communications with their electeds.
Okay, thank you.
Hi, Kevin. This is Haley with News 4. We're hearing that there's a possible backlog when it comes to contact tracing. What can you say to that?
Yeah, as we have had this surge of new cases coming in, it's difficult for us to be able to keep up with our contact tracing efforts. A strike force that we've put together of our disease investigators that are focused exclusively in prioritizing pediatric cases that we receive. And even with that strike force effort, with the number of cases that we have coming in, we're falling behind on our contact tracing activities. Obviously, particularly with school in session, we want to try to jump on those as quickly as possible so that we can take appropriate measures for isolating and having those cases excluded from schools, but also to be able to assess who were close contacts so other staff or students can be appropriately excluded.
And what would you say when it comes to somebody who knows that they've been in close contact, but they haven't legally been notified, therefore they have to continue to go to school or work until they have that notice?
If they know that they have been a close contact, then they should inform the school or they should inform their employer and not go to school or go to work while they're awaiting that notice would be my recommendation.
All right, thank you.
Any other questions for Kevin Dick? Okay, we'll wrap it up. As always, a recording of this media briefing will be on the COVID-19washoe.com website under press and press conferences. Thank you guys for joining us. Thank you, Kevin.
Thanks, everyone.